Is Tamsulosin making you feel dizzy, lightheaded or sweaty? Or do you feel a fast or irregular heartbeat, or perhaps difficulty breathing? And are you aware of the connection between Tamsulosin and an eye disorder? These are really important questions that I discuss with patients in my clinics, and I will answer these questions for you later in this video, so you are fully informed when making a decision about taking your medication. So in this video, I'm also going to explain everything you need to know about Tamsulosin, especially what it does to the body and about specific side effects, to help you understand how it works. And if you stick around to the end, I will give you 7 lifestyle changes that can help symptoms of an enlarged prostate. So let's get started. So what is Tamsulosin and how does it work? Tamsulosin is a type of medicine called an alpha blocker. It's used to treat men with symptoms of an enlarged prostate gland. It helps by relaxing the muscle around the bladder and prostate gland, making it easier to pee. It's also occasionally taken to treat kidney stones to help easing the passing of kidney stones through the urinary tract. And it can also be used for prostatitis, which is inflammation or swelling of the prostate gland, which can be very painful and distressing. Alpha blockers can also reduce blood pressure by relaxing your blood vessels so blood can pass through them more easily. Now, I will talk about this in another video, so be sure to subscribe to be notified when it's released. So what is an enlarged prostate? The medical term benign prostate hyperplasia, also known as benign prostate enlargement, is used to describe an enlarged prostate, a condition that can affect how you pee or urinate and is common in men aged over 50. Now, it's not a cancer and it's not usually a serious threat to health. So how and when do you take Tamsulosin? The usual dose of Tamsulosin for an enlarged prostate and kidney stones is 400 micrograms once a day. Now take your Tamsulosin capsules or tablets with a drink of water while either sitting or standing. Swallow them whole and don't break, chew or crush them. Try and take Tamsulosin in the morning, after breakfast or the first meal or snack of the day. This is because the highest levels of medicine are in your body 6 hours after you take them. This will give you the most benefit during the daytime when you're most likely to be trying to pee, and it's best to take it at the same time each day. So how long do you take it for? Now this depends on why you're taking it. For an enlarged prostate, if Tamsulosin is helping your symptoms, you can continue to take it long term. And for kidney stones, you may stop taking it if your kidney stones have gone or if the medicine is not helping you. In both cases, your healthcare provider may check every few months that you're still having relief from symptoms. If you want to stop taking Tamsulosin, ask for a medication review, as stopping suddenly could make your symptoms come back. Now in the UK, this medicine can be bought by the brand Flomax Relief from pharmacies. If you buy Tamsulosin from a pharmacy, see your healthcare provider within 6 weeks of starting your treatment to make sure it's okay for you to carry on taking this medicine. Now, does Tamsulosin interact with any other medicines? There are some medicines that can affect the way Tamsulosin works. Tell your healthcare provider if you're taking any other alpha blockers, because these may cause a decrease in your blood pressure. Other medicines for high blood pressure, because when taking Tamsulosin, they can lower your blood pressure too much. Medicines for erectile dysfunction, because Tamsulosin could make you feel dizzy or lightheaded. Medicines for fungal infections, and some antibiotics. These may decrease the removal of Tamsulosin from the body. Some medicines that may increase the removal of Tamsulosin from the body, such as diclofenac or warfarin. Other medicines that can lower your blood pressure, as this includes some antidepressants, muscle relaxants, medicines for chest pain, and medicines for Parkinson's disease. Taking Tamsulosin with painkillers. Don't take Tamsulosin with diclofenac. It's okay to take paracetamol or Tylenol, codeine, and other non-steroidal anti-inflammatory drugs such as ibuprofen or Advil while you're taking Tamsulosin. Is there any food or drink I need to avoid? During the first few days of taking Tamsulosin, it's best not to drink alcohol until you see how the medicine affects you. Drinking alcohol can increase the blood pressure lowering effect of Tamsulosin, which can make you feel dizzy or lightheaded. Other than that, you can eat and drink normally while taking it. So who may not be able to take Tamsulosin? Tamsulosin is not suitable for some people. To make sure this medicine is safe for you, tell your doctor if you have ever had an allergic reaction to Tamsulosin or other similar medicines, have orthostatic hypotension, which is a type of low blood pressure that can make you feel dizzy or lightheaded when you stand up. If you have severe liver or kidney problems, if you are having eye surgery for cataracts or glaucoma, if you ever faint while peeing or immediately afterwards. So what are the side effects? Dizziness, ejaculation problems, headaches, irregular heartbeat, sudden and abrupt increase in blood pressure when a person stands up, nasal congestion, runny nose, sneezing and itching, constipation, diarrhea, nausea and vomiting, a skin rash, itching and hives, or body weakness, or a severe skin reaction called Stevens-Johnson syndrome. So what are the serious side effects? Contact your healthcare provider if you feel faint, pass out, or have loss of consciousness for a short period of time. If you get any new swelling developing under the surface of your skin, in your mouth, or on your face, lips, tongue, or throat. If you get a painful erection that lasts 4 or more hours. And call the emergency services if you have a serious allergic reaction. Now, these are not all the side effects of Tamsulosin. For a full list, see the leaflet inside your medicines packet. Questions that are asked in my clinic are mostly related to common side effects of taking Tamsulosin, such as feeling dizzy, lightheaded, especially when you sit or stand up, or sweating. Now, Tamsulosin may lower your blood pressure and may cause dizziness or fainting, especially when you first start taking it, or if your dose changes. If these side effects are bothersome and don't settle or get worse, see your healthcare provider for a medication review, as they may be able to prescribe a different medicine. Now, if you feel like you have a fast heartbeat or difficulty breathing, these symptoms have been reported after Tamsulosin was available to the public, and I would definitely get these checked out to rule out anything else that may be going on. Other post-marketing reported side effects included blurred or impaired vision, nosebleeds, and a dry mouth. And lastly, the connection between taking Tamsulosin and intraoperative floppy iris syndrome. This is an eye syndrome that affects your iris. It poses a risk for complications that can occur during eye surgery. If you're going to have cataract or glaucoma surgery, tell the doctor that you're taking Tamsulosin in advance, because they may advise you to stop taking Tamsulosin 1 or 2 weeks before surgery. This is because it may cause complications during the cataract or glaucoma operation. So as promised, here are 7 lifestyle changes that you can do to help symptoms of an enlarged prostate gland. Drink fewer fizzy drinks and less alcohol, caffeine and artificial sweeteners, as they can irritate the bladder and make urinary symptoms worse. Quit smoking, because nicotine can irritate the bladder and can also make symptoms worse. Drink less in the evening and try to reduce the amount you drink so aim to avoid drinking anything for 2 hours before bedtime. This may help you avoid getting up in the night, so make sure you're still drinking enough fluids earlier in the day. Empty your bladder, so remember to go to the toilet before long journeys or other situations when you know you may not be able to reach a toilet easily. Try double voiding, which means waiting a few moments after you have finished peeing, then try to go again. It can help you empty your bladder properly, but take care not to strain or push. And check your medicines or ask a healthcare professional whether any medicines you take, such as antidepressants or decongestants, may be making your urinary symptoms worse. And finally, eat more fruit and fibre, as this can help you avoid constipation. Being constipated can put pressure on the bladder and make your symptoms worse. Now, if you've enjoyed this video, please remember to hit the like button and hit the subscribe button if you'd like to see new videos that are posted every week. And hit the notification bell if you want to get notified about new videos. And please make a comment in the comment section. Tell me what you've enjoyed about this video or what topics you'd like to learn more about. And you can also check out my other videos and playlist.